Pfizer giving an update on its strategy around potential booster shots that might be needed against COVID-19. They are saying that while it looks promising just to give a third potential booster of their original vaccine in terms of boosting the antibody levels, out of precaution, they are developing a Delta-targeted potential booster shot that they anticipate beginning clinical trials of in August if they get the FDA's go-ahead. They don't know that this will be needed, but they are developing it just in case. Now, they are also saying that what they've seen from real-world evidence, including from Israel, makes them more convinced that they think we're going to need boosters within 6 to 12 months after full vaccination. They say, based on the data they've seen, quote, while protection against severe disease remained high across the full 6 months, the observed decline in efficacy against symptomatic disease over time and the continued emergence of variants are key factors driving our belief that a booster dose will likely be necessary to maintain highest levels of protection. So, Mel, they are covering all their bases, making sure they're prepared against Delta if they need it, but saying they are reassured by what they've seen already in the data of their original vaccine. Back over to you.
Meg, you cited the data out of Israel. Dr. Scott Gottlieb, when we spoke to him on Squawk Box on Tuesday, had pointed out that was a small sample, and I'm wondering if they're continuing to study the efficacy of the original vaccine on the Delta variant in a bigger size?
Oh, yeah, absolutely. They are going to be looking at a booster of the original vaccine to see how that does against the Delta variant itself. There are a lot of questions about those most recent data out of Israel, and it's not even clear they're talking about that questionable number, the 64% protection against infection and mild disease against Delta in Israel, or if they're just talking more broadly about all of the real-world evidence that's been collected from Israel. They say they do start to see a bit of a waning in the protection from the vaccine after 6 months, and that's why they think booster shots will be needed. Of course, it's good for their business, too, if they do.
Yeah, if they get the green light from the FDA, Meg, is there any sense as to whether or not they can give a timeline after that? Seeing the trajectory in which they develop the actual vaccine.
Yeah, it's a really great question about also the FDA. The FDA would need to decide, are we switching to a different variant-targeted vaccine too? The FDA and the CDC's advisory committees would weigh in on that as well. And then how does Pfizer shift its manufacturing to potentially make that different vaccine? All of these things would need to be considered. The good news is it really does look like boosting with the original vaccine does lift up your neutralizing antibody titers pretty high and should potentially be protective, but they are just covering their bases.
Shepard Smith here. Thanks for watching CNBC on YouTube.